Hello, and welcome to the webinar on tongue ties, feeding, and function, what all parents should know. My name is Dr. Sameera Meyer, and I am so glad that you are here. If you are watching this webinar, you're here for a reason, right? You have questions and you are seeking answers. Maybe feeding just doesn't feel quite right. Maybe you've been told that everything is normal with your baby, but your parent gut is saying that something just isn't right. Newborn life is so overwhelming as is, especially as a first time parent. And having feeding struggles on top of that can be so exhausting. As a mom of two, I have been in your shoes, and my goal is to not have any parent feel unheard, not have any parent feel lost in this process. It is really a passion of mine to have you as a parent feel empowered, and I would love to help you and guide you along that to give you some more information so that you can start connecting these dots for yourself and really feel empowered when making decisions for you and your family. So let's get started. Here are some really common symptoms that we see all the time. Infant feeding can be messy. Infant feeding can feel painful to a mom. And a lot of these things are really common. When we're talking to other parent friends, they're saying, oh, yeah, my baby had colic. Or you're talking to another mom on the playground and she's saying, oh my gosh, that reflux, all that spit up, my baby had that too. Good luck. These things are really common and we hear about them all the time. But I want you to know that just because they're common does not mean that they are normal. When the mechanics of the mouth and body of an infant are working properly and their system is regulated, feeding should not be difficult. Feeding should be a beautiful rhythmic experience between you and your baby. Again, whether it's breast or bottle. All of these dysfunctions are just compensations that unfortunately have been made to be very common because we see them all the time. But again, that does not make them normal. So let me help you connect these dots a little bit on how all of these things can be related to tissues that are too short or too tight in the mouth. It can be really confusing to look at all of these and then look at a teeny tiny string in the mouth and say, how the heck are these things connected? So let me give you an example that might make a little bit more sense. So let's take the mouth and the tongue and the lips completely out of the equation. When we look here, we have two shoes that are tied together. So let's imagine that you were born with these two shoes on your feet and they were tied this tightly together. Now, with your normal development and your innate instincts kicking in, you are going to want to move from point A to point B. As you're developing, but if your feet are stuck together like this, you're not going to develop the same as if somebody had their feet separated. So let's say this is what our body looks like, right? And we're trying to get from point A to point B. We're trying to hit those developmental milestones. We would start with a whole lot of bumps and bruises because we'd be falling over all the time. Maybe you would start to crawl. Maybe you could even stand up and start to shuffle. Maybe eventually, yes, you could get from point A to point B, but how long would that take you? Would you be thriving in that environment of moving, or would you simply be surviving? How would your muscle tone look in the rest of your body if you developed with your feet tied together? Let's take it one step further. Let's say we loosen these laces a little bit. So now our feet have a little bit of room to move a little closer to normal and how they were intended to. You would probably still have a lot of struggles. You would probably still have a lot of bumps and bruises and muscles that are not formed properly. But would you be able to shuffle a little bit faster than if your feet were completely tied together? Yes. Would you maybe even be able to kind of walk? Yes. But would you be able to run? Absolutely not. Again, completely off the table. Now, let's say someone identified this early on and they cut that string and they allowed those 2 feet to move as individual units as they should. How would your muscles look? How would you develop? Would you be able to run? Would you be able to jump? What are the possibilities, right? You would be able to really thrive in that environment rather than just surviving. So let's take this all back to the mouth. When we look at this photo here of this is a tongue where the shoelaces are tied super tight together. We can see that this string here is just like those shoelaces tied tightly together. That tongue is not moving in those proper ways. So, what does that show up as? That shows up as dysfunction starting. Now, let's say this baby somehow compensated enough, or the parents didn't have someone guiding them through this process, and feeding was an absolute mess as an infant, but they got through it because your babies are smart. Your baby's instincts are to eat and get themselves nourished in one way or another. So, let's say this baby, their whole body had to take over and compensate to get that milk. Now, what happens when a baby with a tongue like this starts eating solids? Things are going to be dysfunctional, right? What happens when a baby like this starts to speak? Things are going to be dysfunctional. These things are going to show up down the road, even if they were not identified early. But let's say this string was cut early. Let's say this baby's tongue was allowed to move, just like those feet that are allowed to move. What are the possibilities? This is what we want for your child. We want your child to have their feet free. Now let's take it to a different example. You may not even know what you're looking at here, but this is the view that I see. So this is a gloved finger in a mouth elevating an infant's tongue. You can see the ridge of the lip there, and that finger is in there to pull the tongue up. Now, if we look at that first photo and you lift that tongue just a little bit, you don't really see any tie there. It kind of looks like a normal tongue. It certainly does not look like the tongue we just saw before where everything was really tight. Now, let's say we get in there a little bit further and start pulling, and then we get to that last photo and really pull up. And where we see that white string there, now these are your shoelaces loosely tied together. So, this is what's called a posterior tie, and these are often missed because the babies are able to compensate a little bit more effectively than when things are super, super tight. Let me also take a pause and explain a little bit about anterior, posterior, because these terms get thrown around a lot and I want you to really understand them. When we're looking at tongues and the anatomy, that tissue underneath the tongue is there to connect the tongue to the floor of the mouth. It is a string of fascia, okay? And those terms that we discussed, anterior, mid-tongue, and posterior, are simply anatomical landmarks to tell us where that string is located. So posterior means it's towards the back of the tongue, mid means it's in the middle, and anterior means it's at the tip of the tongue, like that first photo that we saw. There's a lot of confusion around this, but what I want you to take away from this is that it is simply an anatomical landmark. It doesn't mean that one has more symptoms than the other. It doesn't mean that one is okay to have and the other isn't. It is simply just information and data on where that actual attachment is. Now, unfortunately, the posterior ties, which are again all the way in the back, are the ones that are most often missed because in order to see it, you have to lift the tongue like this. You have to be properly trained, and this takes a lot more than doing a quick look. This takes a lot more than putting a tongue depressor in there and kind of lifting things up. This takes getting in there on a knee-to-knee exam, elevating that tongue to really get under there and see what's going on. Because if we have this laundry list of symptoms, why is this happening? It has to make sense. So we have to really take the symptoms and the anatomy and pair those two together. This is called a functional diagnosis. We're not just taking appearance and we're not just taking symptoms. We are taking those two things together to diagnose if there is a lip or a tongue tie. Again, it is normal to have an attachment between your tongue and the floor of your mouth. What is not normal is to have a whole host of symptoms that go with it. So, what I want you to know as parents is that you want to get a proper diagnosis for your baby. Your intake should look like a thorough history. We want to piece together the story of what is going on. We want to start at day one. How did your birth go? How is your pregnancy? What does your feeding look like? Walk me through those details. How long is it taking? How long in between feeds? What does the suck look like? What does the entire body look like? We should be looking at not just the mouth. We should be feeling how that neck moves. We should be looking at the body tension. And it really comes down to that team approach. We need to look at our infant as a whole and look at their whole body, not just what's going on in the mouth. So now that we have a little bit of a better understanding of these things, let's talk about next steps because there's so much more that we could talk about. Once you have this information, I hope that you feel empowered and confident to find a provider who guides you through that functional diagnosis. If you are local to the area, I would absolutely be honored to take care of you and your baby and do an in-person comprehensive assessment. The other thing that I can offer if you're not local to the area is a virtual educational consultation. Now, of course, I can't diagnose any ties over video, but it can be really helpful to start putting these pieces together and to just talk through the symptoms that you're having and see if it does sound like something that could be related to oral ties. Your last option is, of course, to find a provider in your area. I do have a guide that helps you to know what questions to ask when you're looking for a provider, because again, not all providers have the same training. I really encourage you to use that guide to find a provider who has done the education, who has put in the work to take the absolute best care of you and your baby that they can. You can also find me on Instagram at Sameera Meyer DDS. I have a lot of information on there, educational videos that may be helpful. I thank you so much for taking the time to watch this, and I truly hope that it was helpful and that you leave feeling more confident and empowered and get the help that you and your baby need and deserve.